thought that as we are going through unprecedented times and people are spending more time at home, we thought these webinar seminars would be interesting and quite helpful for our viewers. And we wanted to do the very first one, the kickoff one, with Dr. Oz. And I am grateful that he accepted it and with his busy time. I want to just lay out that it is going to be 30 minutes altogether. We will be talking with Dr. Oz and take his views about the COVID at present, COVID-19. And after he shares with his views with us, I might have 2-3 questions from our viewers and share with him so that we end up our today's webinar in 30 minutes. I mean, I don't want to take so much time, but Dr. Oz, I think I don't need to introduce him. Everybody knows him very well. He is worldwide known heart surgeon, and he is the host of Dr. Oz shows. And Mehmet, once again, thank you very much for being with us. Basically, we would like to hear your views about where we are standing with COVID-19 now. Are we at the second stage? Some people are saying we are approaching the second stage. Some people are saying we are at the second stage. There's a balance of the government wants to do some balance in terms of economics and also in terms of protecting people. And they are trying to keep this balance, but also it applies to the people's life as well. We all want to have some kind of a balance. We would like to hear your views about, where we are standing today, how close are we to the vaccine, and how we should move forward. Well, the floor is yours. Thank you again once being with us.
Thank you for the invitation, and I'm glad to help the American Turkish Society. I've been a proud board member for many years. Ahmet Ertegun was a patient and a friend, and I'm very proud that he started our group. I realized the importance of this dialogue, in part because of times like COVID-19, when you've got to compare how different countries are doing and learn the best practices. And if you look just at the surface, the numbers of cases in Turkey and numbers of deaths in Turkey are lower than we would have expected, and they're higher in the United States than we would have expected. So I wanted to walk you through what's happening and what my projections are for the future, including some updates on the vaccine. So at a high level, we're still in phase 1. There was a sudden increase around most of the world in March. Through April and May, most of the world started to see a decline in cases. That happened in the northern parts of the United States. In the southern states in this country, there was an explosion of cases that happened not in May, but in June, in part because the entire southern part of the United States was quarantined very aggressively, and there really weren't any cases there. So young people listened to the government. They saw the warnings to stay away from other people because it was dangerous. They listened carefully. They stayed at home, and nothing happened. And then they were allowed to go out and get a haircut, and get their shoes shined, and nothing happened. And then about a month later, it was a holiday in the United States, Memorial Day, and people went out, and the young people said, "You've been dishonest with us. You told us we had to stay inside because it was so dangerous," and it turns out it wasn't that dangerous. And they broke all the rules. They did not respect the virus, and it led to a growth in cases where there were no cases before in Florida, Texas, Arizona, Southern California. Now, that's one big reason that although there were many cases, the death toll hasn't been as high as it could have been. Part of the reason it was a lower death rate is because of the age of the people getting sick, but also part of it was the care has gotten better, which is one of the good news items for the entire world. The chance of being admitted to an ICU is probably half of what it used to be. And that's partly because we've gotten better at the protocols. It's not that we have any particular medication that is all that powerful, although we have several now that most of us are optimistic about. But generally speaking, we understand the virus, when to move forward with aggressive care, when to be more conservative, and it's led to better outcomes across the board. Now, all that said and done, one major issue remains is what's going to happen when the weather gets cold. This virus, like most viruses, appears to become less of a problem when the weather is warm. Some of it might be the humidity, makes the virus particles heavier, they don't travel as far. Some of it might be the fact that we're outdoors. And think of the virus spreading when it's aerosolized, like a cigarette smoker or someone who's who's vaping. So they're pushing the smoke out of their mouth, and it's going and spreads all over the place, creates a cloud. That cloud follows you in a small room and keeps in the room, right? It'll rise to the high part of the room and stay there, and you can even walk through the cloud a few minutes after it's been pushed out by someone's mouth. Whereas if you're outdoors, the smoke goes away. That's why we tell smokers to go outside and smoke. Don't smoke indoors. And the virus is sort of the same. When you're outdoors, it's highly unlikely to cause a problem. That's why we don't even know of major spreads of cases outdoors. But indoors, we know specifically that it happens, especially if it's a poorly ventilated indoor space, as opposed to, for example, an airplane. In an airplane, it's much less risky because all the air in the plane is continually exchanged, just like it is in a hospital room. And so you've got half the air coming through the air vent that's clean air from outside the airplane, 35,000 feet, there's no virus there. And then we have, the other half is recirculated, cleansed air that even if the person had virus in it, most likely would be cleared out or other infections. So you have a relatively clean supply of air. That's why airplanes always open that air vent, aim it at your chest to blow away any air that's coming towards your face from the people in the seats next to you. And so the ventilation quality sure makes a big difference, because if you're a well-ventilated school, the kids can probably stay in school as long as you're carefully putting the kids in cohorts and not allowing them to spread to each other. If you're in a poorly ventilated school, the virus is going to be circulated inside the rooms and surrounding rooms, so it's a little less safe. Now, I bring up the indoor-outdoor issue for an important reason. The southern states in the United States are very warm in the summer. They have to use air conditioning, so people are indoors a lot. That might be one of the reasons we're seeing more virus spread. Whereas here where I am in New York City, it's a very cool day today. So perfect to go outside, have a picnic, walk around outside, exercise outside. You don't have to be indoors. When the weather gets cold to here, and it is Istanbul with the same latitude, you're going to see people going inside. There will be a second wave of this virus, especially because it's going to fare better in the cold weather anyway. And hopefully, because we've gotten smarter and we respect the virus, we're going to be wearing masks, washing hands, avoiding crowded indoor areas, then we'll be able to reduce the chance of getting infected. But the difference between November, December, and last March is we know what we're dealing with. So I think we'll have the spike, but it won't be nearly as bad as it was last spring.
I see. Thank you. And what about Mehmet, about the vaccine? Do you think are we close to find a new vaccine? Can we use it? I mean, that's another, of course, issue. I mean, how people will feel comfortable with the new vaccine coming up. What is your views about that?
Well, there are dozens of vaccines that are being developed. There's about 17 the last time I looked that are actually in large clinical trials. I know of several of them that have already enrolled close to half the people that they need. These, by the way, are trials with 30,000 people in them that are followed for 6 to 12 months. So people understandably are going to be nervous. They say, hey, you're rushing the vaccine. Normally these vaccines take years to develop. You've developed this in just a few months. How safe could it be? But I want to caution people who say that most of the time saved is because there wasn't wasted time with red tape and government regulations and this usual delay between proving the vaccine works and having enough vaccine to administer. It could be a year. Now we're actually making the vaccine before we're sure that it works. Just in case it works, we can start using it. So I think it's being done thoughtfully. By the time you have 30,000 people in a vaccine and you watch them for 3 to 4 months, you have a pretty good idea that there are no early complications, which is where most of the complications would be apparent. You don't know about long-term issues, but you rarely know those anyway, even in the vaccines that are developed more slowly. So 1/3 of Americans are reluctant to get the vaccine, but 2/3 want it. And that's all we need. If 2/3 of the people get the vaccine, we'll end up with a reasonable result and people will be able to have herd immunity, so it slows the spread. There's two major kinds of vaccines. There's the old-fashioned kinds where you take a virus and weaken it. And then there's the new ones where you take just a bit of the genetic code, the mRNA, and you fool the body into making the antigens, the proteins. That's never been tried before. Those are newer companies. The British are using the old-fashioned vaccine, the Americans, the newer vaccine. Well, we'll see. They're both, again, enrolling lots of people. So depending on how safe they appear and the ability of the vaccine to protect the people getting it and the people who aren't getting the vaccine, getting a placebo, if they're in an area where there's a lot of illness, they'll get sick. And so we'll see the difference pretty quickly. One of the things that will hold us back is if the virus goes down a lot, there won't be enough people in the control group getting sick. So it'll slow down our results.
I see. Thank you. As someone living in the United States, what do you think where do you think that the government did something right, or where do you think the government went wrong? Is there any particular areas that you would like to share with us?
Well, the biggest mistake was early on, there was no testing. It was a little bit, I think, of the arrogance of believing that we could make an American test system that worked well, but the group that was doing it, the CDC, is not a commercial laboratory. They're a government agency. And when they tried to make the tests, they did not make the parts of it correctly, so it didn't work. And so it was 2 months from when we first heard about the virus in China until we had a testing system in this country, which means all of our leaders were blind. They had no idea how many people were sick, how many had COVID-19, how fast it was spreading. And that really hurt the country's ability in the beginning days. And then we ran into the political debate, which has become a big issue in the United States. It is in many parts of the world. And the big argument is that, you know, when you mix politics and medicine, you end up with politics. The medicine gets drowned. And so researchers and clinicians, doctors trying to articulate their best thoughts often had their opinions politicized, so that you never knew if they were saying it because they really thought it was true, or they were saying it because they were trying to serve a higher political purpose. And the politicians with media would pick one idea or the other and support it. So it created a lot of confusion. The basics are that if you really want freedom, you'll wear a mask and socially distance, because that's the best way to reduce the chance of the virus spreading. The virus behaves like it's a flu virus if you socially distance yourself. But masks are not a cure-all. And I fear that we made people think that if you wear a mask, you can do whatever you want. It's not the case. And the Swedes, who never shut down, are saying that they don't think their people should wear masks because it gives them a false sense of security. And those are the kinds of disagreeing information when the head of the Swiss response to the COVID says the opposite of what the US government is saying. Well, they're both reputable people. You have to believe one or the other. And politics doesn't deal well with those disagreements. So people will grab one or the other. And it created a lot of confusion in this country. And Americans are very free-spirited people, did not want to put masks on if they really weren't convinced it made a difference. They didn't want to be ordered by the government to put something on their face. And that led to a slow response, especially in the southern states, to the virus.
Thank you very much. I have 3 questions. I mean, we wanted to limit it because of the time. So maybe I should share with you these 3 questions, and you can try to help us. The very first question says, Turkey has had a degree of successful treatment of COVID-19. Can you tell us a bit about their method of treatment, and at which point of the offset is it used? This is the first question about Turkey. And the second one is, the question is about how long do you think realistically the pandemic will last globally and in the United States? This is the second question. And the third question is about the schools. The question is about, do you think that the schools and universities can be open in September or October?
So let's take this in order. Turkey has done a good job, I think, of aggressively shutting down when the virus hit. Now, remember, shutting down is an experiment. We don't know if that's the right way to go, but we know that it does slow the rise of cases. It allows the medical community to catch up and understand the problem better. So it would theoretically help management of cases if they're happening later than early. But Turkey was able to slow down the growth of the cases using that approach. They've had 6,000 deaths the last time I checked, which was this morning. And I'm optimistic that even with an increase in the fall, it won't be terrible. The medical community is very aware of the treatment protocols. There are some people feel very strongly about use of some medications in Turkey. Hydroxychloroquine is one, but also steroids and antivirals, and these techniques have been used by different Turkish centers with success. But we don't have randomized trials for some of the data, and some of it we do. So we've cobbled together a system that works for Turkey. It's also a country where people take care of their older members of the family, which generally is a good thing, because if you're in a nursing home, the chance of you dying was dramatically higher. In many United States areas, half the deaths were in nursing homes. But if it's your home with your loved one, either those people are healthier or you're able to protect them better than if they're a nursing home. That might explain some of the reduction in deaths in Turkey. Of course, when you come home and you're sick and you give it to your grandmother, then you've infected the most vulnerable person. So it's not a perfect solution, but it might have benefited. Half the deaths in Sweden, even, where they never closed down, happened in nursing homes. All right, let's shift to what's the long-term prognosis. I think that we have until the weather gets warm again to deal with this virus. So it's going to take until the end of this year to understand if we have vaccines that work, probably till the first several months of next year when we give them more widely. So let's say by next June, we'll hopefully have enough people vaccinated and enough people who've gotten sick and done okay and recovered that will have herd immunity. Plus, I don't know if you know this, but about a third of the population may already be immune to COVID-19. Because in data from Germany and from Sweden, it seems like many people have had the common cold in the last year or two. And the common cold is often caused by a coronavirus, a cousin of this virus. And so if you had a common cold last year, you may already be protected against this virus and not even know it. That's why married couples are so strange. One person will get sick. The person lying in the same bed with them will not get sick. How is that possible if it's so contagious? So we believe that this virus has been around its cousins for quite a while and may have given you some immunity, or your immune system strong enough to cope with it and make you asymptomatic, one or the other. Finally, schools. I have sent my grandkids back to school. They are small, but in that age group under 15, the chance of having bad complications of COVID-19 has been very low. And so because there's not a huge complication rate with young kids with the infection, the disadvantage of having them out of school is greater than the risk of the virus. Now, this is not true for the teachers or for the parents of the kids, but it's true for the kids. So if we're focused on the children, that's been the argument that many have made. I have to side with the American Academy of Pediatrics, who speak for the pediatricians, the National Science Foundation, who speak for the Scientists of America, and the British equivalent just this week also came forward and said, we have to send the kids back to school. The benefits far outweigh the risks of the infection. Do it. So young kids, that's what I would do. There's all kinds of rules the CDC has put forward that make sense. 6 feet apart desks, putting blinds in the floor so the kids don't jump on each other, having them come to school at different times than everybody else so that you're not all exposing to each other as you get to school or leaving school. These are all ways of creating cohorts or tribes of kids. So it's 15, 20 kids linked together, not every child in the school, so that if one kid gets sick, which is going to happen, then just that one class goes home. The rest of the school is able to stay there. And that way you might have one class go home for 2 weeks for quarantine, but the rest will not be hindered in their education. Otherwise, you'll have a continuous rolling shutdown of schools. Universities are a whole different game. And my son, as you know, is a senior at Harvard. He's not allowed to go back to school. In fact, he's a varsity athlete, and they canceled the season. My nephew is a freshman at Harvard, and he's allowed to go back because they want the freshmen to meet the other kids and have a Harvard experience just for a few months. But the school expects to shut down at some point. Many schools like Notre Dame, University of North Carolina, big schools, respected schools who are trying to open have now closed. Many others are closed and done. So I'm of the belief that universities should take this approach. We eventually will get shut down. Let's get everyone together, use a bubble to protect everybody. So if you get in the bubble, you're like the NBA basketball team, you stay in the bubble. Everyone gets tested. As soon as we identify a significant pattern, we pull those kids and put them in a separate dormitory. But you don't send them home because you don't want kids going home and back, because they'll just bring infections in or spread infections out. Once you're in school, you stay there for 3 months. We try to get everything done before the weather gets cold, and take off a few months. So at least you get one semester of the year in. How well will that work? I don't know, but I must say, I'm not as concerned about college kids or high school kids because they can distance learn. But middle school kids and especially elementary school kids do not learn on computers well. It's not smart for us to think we can do that. And it especially hurts poor people. People in the bottom half of the financial pyramid do not have an ability to take care of their kids when they go to work. So they use the school system. We're penalizing them because they don't have tutors coming to the home.
Thank you. Thank you. One quick question. This question is coming, just appearing, and they are asking about blood type A. The viewer is asking, is blood type A people, are they really vulnerable to COVID-19? And would like to have your view. This is the last question, actually.
They are more vulnerable. The best type blood to have is O. Many Turks are blood type O. I'm a blood type O. Blood type A's are often Northern Europeans, and blood type B's are usually from Asia. And they're different because of how they have these sugar molecules on the surface of the blood, and the less of those molecules you have, the more resistant you are to malaria, because malaria causes your blood cells to clump together and causes all kinds of complications from small blood vessel closures. So over time, humans began losing some of those molecules on our blood cells. So we went from having A's and B type blood to mostly O's. And the O's are not only resistant to malaria, but they also are better able to fight off the virus. So you're a little bit at disadvantage, but not a huge difference.
Dr. Oz, thank you very much for your time. I am sure it has been very interesting and also helpful to our viewers. I wish you safety and health, and thank you for being with us. And I would like to thank for all our viewers who joined us, and I hope they enjoyed the first webinar. Thank you very much.
Sağ olun. Thank you very much. İyi günler.
Bye-bye.